Uterine fibroids are non-cancerous tumors that involve the smooth muscle tissue of the uterus. It is a fairly common occurrence. We see a prevalence as high as 70% of women of childbearing age. Symptoms associated with uterine fibroids can be varied. Some women experience pelvic pressure, some women experience heavy bleeding, some women experience constipation, difficult intercourse, and of course heavy bleeding. However, the vast majority of women have no symptoms at all, and for that reason we don't know all the time that it's even a problem. We know that the prevalence of uterine fibroids tend to be higher in the African American population. Up to 50 to 70% of people will have uterine fibroids, but in most of those patients they are asymptomatic. There is absolutely hope, and hysterectomy is not the only option that we have for treatment. And we know that. We've got so many new technologies that are on the horizon, things that are tested and proven now that we use daily to manage uterine fibroids that does not lead to hysterectomy. So it's very important to know that hysterectomy isn't your only choice. There is hope for retaining your fertility. There's hope for retaining organs that are not abnormal. If you're having a problem with uterine fibroids, we can treat the uterine fibroid itself, whether that be a myomectomy where we remove the myoma itself, or it be something more extensive. But hysterectomy is not the only choice or the only option that you have in the treatment of uterine fibroids.